When it comes to GBV cases, the individual in question is actually the sin themselves.
The recent study by Uganda Bureau of Statistics in collaboration with ICF revealed that 22% of women and girls in Uganda have experienced sexual violence in their lifetime. Data from the United Nations Population Fund indicates that over 5,000 sexual gender-based violence cases have been handled since the special sessions began in 2018. Judicial reports also show that conviction rates have improved significantly from 20% to over 81% by 2024. Despite this progress, stakeholders acknowledge gaps in witness support and public sensitization.
Emergency shelters, mental health counseling, and medical care are often unavailable or underfunded. Untrained staff or discriminatory treatment, further discouraging them from seeking.
The situation is worsened by lack of sensitization and absence of the Witness Protection Act, which could enable survivors and witnesses to safely testify in court.
The conduct of our parents also, leaving children at home is now becoming common. This is one of them. You go to the door and you go for Valentine's celebration. Recently I had one, an 8-year-old was returned 20 times in the family platform.
We need to conduct a study. What is this that is actually pushing men to commit some of this? Are we going to win this war without actually involving men who are actually the what? Who are actually the majority perpetrators?
To reduce case backlog and ensuring timely justice, the judiciary has adopted alternative dispute resolution mechanisms, including plea bargaining for sexual gender-based violence cases, an approach that has drawn mixed reactions from stakeholders.
Religious or customary courts prioritize reconciliation over accountability, pressuring survivors to forgive their abusers or return to violent relationships.
We are trying so much to make sure that our colleagues within the Child and Family Protection Unit and CID also have the necessary tools to make sure that they can put together the necessary.
Investigators are also sometimes blamed for failing both survivors and suspects.
Yeah, I think the last 24 form I read was of a 5-year-old police form to read it, and the doctor wrote hymen, worn, torn, and worn out.
We need to provide psychosocial support, not only to these victims and survivors, but also the caregivers.
These views were shared during the symposium, aimed at addressing the growing challenge of sexual gender-based violence in Uganda.
We need to be able to automate a certain key process of the DNA analysis.
Let us in Uganda where no survivor of GBV is silenced by fear, stigma, or systematic barriers.
While officially opening the event, Minister of Justice and Constitutional Affairs, Nobati Mao, reaffirmed government's commitment to combating sexual gender-based violence and urged all stakeholders to take corrective responsibility.
There's a lot of impunity. The people who indulge in sexual gender-based violence boast about it. From the point of view of the Ministry of Justice, we commit to doing everything possible to support efforts at prevention, efforts at response, with the overall goal of ending impunity.
He also stressed the need for more sensitization and the establishment of additional remand homes for survivors.
We have to prevent GBV. That is really the idea. In other words, those who perpetrate it should realize that there's a very heavy price to pay if you indulge in it. The moment that message is clear, people will think twice. So far, I think that message is not out there.
The one-day symposium sought to generate ideas on how survivors can access justice and protection throughout the judicial process, shielding them from retaliation by perpetrators or their associates. Deborah Namamonde, Viola Nansuga, UBC News.